Today I'm going to share with you about venous leak and erectile dysfunction and how venous leak leads to erectile dysfunction in men. Venous leak is a condition where you have varicose veins of the pelvis, and these veins become very big, and what they do is they drain blood excessively from the penis during an erection. As a result, the man is unable to sustain his erection due to this leak and is unable to have intercourse. This results in then what we call erectile dysfunction. Psychologically, it affects many men. It affects them mentally, it affects their relationships with their partners, and is very distressing. Many men don't like to talk about it, especially so since it affects young men more than old men. In fact, in all the cases of erectile dysfunction, venous leak is responsible for up to 80% of these cases. So how do we diagnose the condition of venous leak? One is a very good history taken from the patient. Although we may ask very intimate questions during the consult, at least we know from the patient's history what the problem is. And sometimes that gives us an indication that there is a problem with the venous leak. But the real diagnostic test actually comes from doing two things: an ultrasound scan and a CT scan. So we can do the ultrasound scan in the clinic, and in this ultrasound scan what we do is we examine the patient's blood flow in his pelvis and also in the pineal gland or penis, and sometimes we complement that with an extra imaging, and that's a CT scan. With these two images, which are both non-invasive, we can diagnose the problem of venous leak. So frequently men who have had venous leak will have tried seeing many doctors. Some people will have taken some medication like Viagra or Cialis to help them attain an erection, but they still find that they are unable to have intercourse because they cannot sustain the erection. So after we diagnose the venous leak with an ultrasound or a CT scan, what we then do is then consider treatment. Right now, the latest way of treating this is actually minimally invasive. In fact, it is almost non-surgical. And now, if you know the problem of venous leak is actually these big dilated veins, as you can see there on the screen, what we then do is reduce the leak of these veins, and we use sometimes small metallic inert biocompatible coils, or we inject some glue that's also biocompatible. As a result, the leak is reduced significantly, and so blood is now retained inside the penis for longer periods. As a result, the man is able to sustain his erection and continue to have intercourse like he did before this problem developed. This is a very good procedure because it is done first minimally invasive, almost non-surgical, with local anesthesia and a little bit of sedation, and it's done like a day surgery. More importantly, the men who have undergone this procedure tell us that by the next morning they are already feeling a lot better, and they see an improvement in their erectile dysfunction. And many men then subsequently also go off all their medication to treat erectile dysfunction and are happy. In terms of how long this is sustainable, this has been shown to be a long term. So many men up to 2 to 5 years are still having very good results and are very, very happy. So this is a way of doing this procedure. We call it embolization and coiling for treatment of venous leak resulting in erectile dysfunction.